everyone. Just today we want to inform you why we are here, because you know we have a lot of new nurses, and we receive some OBR regarding the patient for new onset DKA. That's why we will conduct this session, me, Dr. Nasim, and Dr. Shaima, and the dietitian. First of all, I want to ask you, when you call the diabetic educator, when we call diabetic educator, within 2 hours from the patient admission, especially in new onset. Okay, within 2 hours. 2 hours, it's not, tell the diabetic educator now you will come, just to inform her, to arrange her schedule to come to the patient. Because most of the patient time during the admission, it's for education. And the education, it's not given in one session. It's given 2 to 3 sessions per day till discharge time. And when your patient asks you about the educators, today I visit to the patient, I give the education, then the nurse, she sits to the patient, and the patient asks, again, please, can you send the educators, because I want to clarify some point. You have to inform the diabetic educator immediately to come to the patient. Then, when you have order from the physician or consultant, they make order, and the doctor wrote, please call educators to educate the patient this topic. Okay? And when we, again, for the clarify the order, doctor, he wrote order, and it's not clear for you, like correction, like insulin dose, or something like that. So the educators, it can help you. And if you want to doubly check about the insulin dose and correction, what I mentioned, because most of the nurses, they don't know how to deal with those patients, or how to make the correction. Okay, how to make the calculation, you can ask help from the educators. I hope this 4 or 5 clear. Okay. Okay, about the insulin type, it's different. We have rapid acting, short acting, and long acting, and intermediate, and mixed insulin. I will not talk about those or all those, and I want to talk about only for rapid. This is what we are using in the hospital. Rapid acting, short acting, and long acting. Rapid acting, like NovoRapid. When we give the rapid acting, the rapid acting given to the patient before meal. But for pediatric, if below 5 years, you give the insulin after the meal, because we are using the carb count. We ask the patient eat, then we will check how many carbs the patient eat, then we will give the insulin about the carb. Okay, but if the patient up to 5, no, we will give the insulin before the meal immediately.
What type of insulin?
What?
What type?
No, the rapid acting, NovoRapid. Okay, the short acting, the regular, we should give the patient before 30 minutes from the meal. Okay, because it takes time to start, not like the NovoRapid. We give before the meal immediately. It starts after 10 minutes, 5 to 10 minutes. The duration, the peak after 2 hours. The duration 2 to 3 hours. This is the rapid acting. For short acting, we give to the patient before 30 minutes. The peak after 2 to 4 hours. Then the duration 4 to 6 hours. Okay. When the patient take the insulin R and N, rapid acting and intermediate, we should to give snack. Even the doctor, he not wrote the snack, because when we the peak, it's located together, okay, become the patient hypoglycemia, so we need to give the patient a snack. Okay. For long acting, it's fixed. We give to the patient as fixed time, like as doctor ordered 8 p.m. like 8 p.m. because it's working 24 hours. Okay. The rapid acting no need snack because it's fixed basal bolus. Rapid acting, when we give the insulin as short acting with intermediate, we should to give snack. For long acting, no need to snack, only fixed time as doctor ordered. Okay, because no peak for the long acting. Okay, in case of special order insulin, okay. Again, we should to follow the instruction as doctor ordered for the insulin time. Okay, when you check the blood sugar, because during my visit to the patient, I see the nurse, she about the procedure. It's not like what we are teach the patient. That we want to clarify this point. How we do this procedure? We teach the patient two options if you want to break your finger. First, clean your hand with water and soap and dry and break the finger and gentle massage, not hard, because when you make hard, it's become the interstitial fluid mixed with the blood and then become the wrong breathing. Okay, gentle massage, then you break the finger, it's become the drop of blood, it's come out and immediately you can take this blood. If you use alcohol swab, the first gentle massage, then apply alcohol swab, then break the finger, then take the first drop out, then take the second. Why? Because the alcohol swab diluted with the blood and give us wrong reading. Okay, you take the second drop. Then when you make this procedure, as doctor ordered before the meal and after 2 hours, and when the patient have hyperglycemia symptoms, you can do this test. Okay. Again, after 2 hours from each meal, as doctor ordered. Okay, when the patient have hypoglycemia, how we can manage without the doctor? Okay, if we can reach the phone and inform the doctor, it's okay. But you can manage the patient when the patient below 70, this is what we are teaching the patient, when the patient feel symptoms for hypoglycemia, like shivering, like sweating, like peripheral vision, like hungry, like the patient feel any signs of hypoglycemia immediately before you check the blood sugar, you give 15 grams of simple carbohydrates or simple sugar. Like what? Like half cup juice or half cup water with 3 spoons of sugar, and you let the patient drink. After 15 minutes, you check the CBS. If the blood sugar above 70, you give a complex carbohydrate like a small sandwich, 1 cup of yogurt, 1 cup of milk, 1 complex carbohydrate. If 15 minutes, when you check, you will receive the below 70 the blood sugar. No, you will not give complex carbohydrate. You will give simple carbohydrate, again half cup juice. You give the complex carbohydrate when you reach the blood sugar above 70. Because if you give the complex carbohydrate below 70, you will not give the blood sugar going up immediately, because it takes time, because complex carbohydrate. Okay, then again, if like you see the patient again hypoglycemia and he don't want to drink anything, you can ask the kitchen to give you honey or something to put in the gum, and you will make a small massage out. It can help again. After you give this one, you will wait 15 minutes, then you will check the blood sugar. If the blood sugar above 70, good, you will give 15 grams of complex carbohydrate. If below 70, you will give again 15 grams of simple carbohydrate, then you will wait another 15 minutes to check. I hope this is clear. Okay. Because this is what we are teaching the patient, but again, when I see you or I see some nurses dealing with those patients, no, they give only 15 grams of simple carbohydrate like juice, then she leave the patient. After again 15 or 30 minutes, the patient become hypoglycemia. Nurse, please give the patient a small sandwich or a 1 carb after simple sugar. It's very important, okay? And this, when you are damaged like hypoglycemia, don't give insulin, okay? Because we need to reach up the blood sugar, not return back for hypo, okay? When you receive like the patient has hypoglycemia during the meal, what we are doing? You will give one carb out of the meal. Like example, doctor he wrote for each carb you give 1 insulin, and the patient he eats 5 carbs. You give 4 because 1 it's for hypoglycemia, and you will calculate 4 carbs like for international unit insulin. Okay, so please follow this, and if you have any question, you can reach me immediately, or you can call the doctor or the dietitian, please. Okay. Okay. When and how we'll make the correction? The correction time when? When the doctor told you, please make correction before meal, or when the patient in the meal time he refused to eat and the blood sugar high, what you are doing? You will make the correction. Correction. The formula is the blood sugar now in the machine minus target divided by sensitivity. Example: the patient now has 300 milligram.
CBS.
Okay, minus 100 because the 100 is target, and the target and the sensitivity. The doctor who wrote this. Okay. 300 minus 100, it's equal to 100. 200 divided, let's say 100. Again, the sensitivity, the doctor, he wrote this. It's become 2. 2 you will include in the meal time. The patient, he want to eat 4 carbs, and each 4 carbs, 1 unit per 1 carb. It's equal 4. 4 plus 2, you will give to the patient 6 after meal if the patient below 5. If after 5, you will give before the meal immediately. Okay. Again, we talk about the CBS procedure and the procedure for insulin injection. Okay. All of us, we know about the insulin site in the upper arm, in the thigh, and in the abdomen. When the patient here in the hospital, we always give to the arm, to the arm, to the arm, to the arm. And some patients have hypertrophy. And then during the patient here, the blood sugar, it's not below down. The doctor, he will increase the dose because, he assessed the patient, but he didn't see exactly the site. So please, when you give to the patient insulin, check the site. If you will see the hyper or lipoatrophy, use the other side. And now you give this side. During the endorsement, let the other nurse, I give in right arm, and where exactly, because to make further with the last dose. Please keep this one because it's really help the patient adjustment. Okay, and please, when you will prepare the side, don't use the alcohol swab in hard because it's gum allergy for the patient, because you know the patient, diabetic patients, about the immunity, most of those patients have allergy. And after the insulin, don't, yes, because you know it's make delay for the insulin absorption. Okay, when you give the glucagon in the hospital, only for coma and seizure. For each patient, like before, you have to make order. Any patient admission, especially in new onset, when the patient arrive, you will make order. Even the doctor he not wrote, you will make order for glucagon, because we don't know what's happened in the patient during the admission. So you will prepare as before, okay, and keep it in the patient tray. Okay, most, or I will not say most, all of the units, when the patient has insulin pen, they are not using the pen of the needle pen. They are using the syringe, the one here. Sorry. They are, it's not working. Okay. They are insulin pen, they are using syringe. No, it's not right. Because each syringe, each pen, they have 10 needle. Because this is what we are teaching the patient. When you use this one, you will make conflict with the patient. How we will make this one? How to apply? Okay? Please use this one. If you don't have, go to the medical store. They have. Okay? Because when I give to education to the patient, I teach him. When I visit him another session, he told me, they give me by insulin syringe. Okay, please follow this one. Okay, for regular, okay, it's fine. You use this insulin syringe because this is the right syringe for regular here in the vial. But for the pen, no, pen needle. Please, please, please use this. Okay. Okay, thank you. If you have any question, anything, please ask me now, and later for the future you can reach me immediately. My name is Latifa. My numbers in the operator, tell they can reach me immediately. And there is Wafa and Zaina and Masha'il. They are those diabetic educators also. They can help you. Okay. Again, any question? Okay, Dr. Shema, she's now with us. She will